taken our seats, I'd just like to, on behalf of the Consumer Organization, Health Organization, welcome you all here to today. And, oh, you're here all day. And again, we take it very seriously that you've given your time and energy to be here. And as such, we're looking for the very best people possible to meet your needs in terms of your health care and health choices. And in light of that, this is the first time we've brought Kelly Armstrong from Jacksonville, Florida, and she's going to be doing something new that I've never seen before, so I'm really looking forward to it. She comes with a pedigree of a very long letters and stuff like that, so I feel sure that we're in for a great treat here, because the first person was just telling us in the last lesson about how scars and tissues affect different parts of the body, you know. So right follow that, we're getting a specialist in that field. So it's quite synchronistic. Anyway, now that's enough from John. I don't want to take any time away from your presenter, but I am your moderator. If there's anything I can add value to your meeting here today, please let me know. So with no further ado, please put your hands together for Sylvia. Excuse me, Kelly Armstrong. Sorry.
Good afternoon. Thank you for coming and for being interested in scars and adhesions. Could I ask you guys to come over here? And then that way the room doesn't feel like it's separated and we can just kind of all be together. So, is that good? Sorry.
It's okay.
So how many of you guys are therapists and actually treat patients? Okay, and then how many of you are here to learn to heal yourself better, to treat yourself? Maybe you're in pain or your family members. Oh, okay, good. Lots of us, and yes. So it's a great show. There's lots here. I'm very excited to be sharing this topic with you. I think that some of it will be fascinating and exciting and maybe even a little bit shocking. So this is my passion, scars. I am a therapist. I've been an occupational therapist for 20 years. I've specialized in pediatrics and pain management, and now I'm looking at women's health, because particularly what we're seeing with the scars and how when they're released electrically, what the body's doing and how it's responding. Okay. Okay. So what do we really know about scars? What do you guys think when you see a scar? Somebody tell me something.
It's an interesting story.
Yes, and that's one of my favorite parts. Every scar has a story, and most of them are quite profound. Something else? Somebody else was going to say something. What else do you think when you see one of these scars? A reminder. Very emotional. A lot of emotions come into play when we see these significant scars, because you may have one on your body or your family, but you certainly see them on your patients, okay? So the scars are symbols, usually not the best circumstance. They have energy trapped in them as they heal. A lot of times there's pain still left in a scar. But what we're going to look at today, we're going to quickly look at 5 things that a scar can do to your body that you may not know yet. And then, if you guys are open, I'd love to do a couple of demonstrations on anybody who has a scar. Preferably a tummy scar is what I would like to demonstrate a little bit later. And you'll actually see the tissue change, pain levels change, tightness change. So these are some of the things that we're going to talk about. Okay, so what is the makeup of a scar? Well, this is what we are taught in school, okay? Even as a therapist, we're not taught very much about scars. What we are taught is that there's an injury or a wound, it clots, it scabs over, and then the tissue becomes a scar. And when that new tissue heals and forms, it changes. It's not the same as the surrounding tissue around it. It never goes back to that same texture. Okay, so you have a scar now that is healed, and the electrical value of that scar tissue is different from the surrounding skin. So that becomes a problem internally and health-wise in our body. What we are taught in school as therapists is to do cross-friction massage to a new scar, because that will help to desensitize the pain as it's, if it's tingling or itching or painful, it will help to bring that down and soften it. And it can also help the keloids from getting bigger. So we want to keep that scar maturation as small as we can. We are taught that in school, and that's normally what a therapist is going to do typically to a scar. And that's by doctor recommendations. Outside of that, our medical field doesn't really recognize that scars do a whole lot more to mess up the internal function and the chronic pain in the body. So what we're going to look at is that scars and adhesions actually cause sympathetic upregulation in the body. Now, who knows what that word means, sympathetic upregulation? It's a big word. You've probably heard of it, but you may have heard of something called fight or flight with your nervous system. That's what sympathetic upregulation is. And basically, our nervous system that we're focusing on is the autonomic nervous system, and it has two parts. It has the parasympathetic branch, and it has the sympathetic branch. And our goal for our own health or for our patient's health is to help that balance be perfect, okay? So if you're in a sympathetic upregulated state, you're stressed, your body's stressed. Could be by a multitude of things, okay? And stress makes you sick. So pain and dysfunction or illness proliferates or grows in this sympathetic upregulated state. So that's really our focus, okay? Our goal is to change that into a healing state. If these two branches are balanced, then the autonomic nervous system is balanced, and you're healthy and you're happy. Sympathetic upregulation that we're just talking about, it causes disease and pain, okay? We're interested in the autonomic nervous system because it controls every function in your body. So right now, as you're sitting here in the room, your body is doing all kinds of functions, everything that's going on, your heart rate, your breath, your metabolism, your blood flow, your circulation, your muscles, everything that's happening in your body right now, it's doing on its own because it knows to do it. Okay, so this is very important to our health. We want this to be strong and to be healthy. When the pendulum swings into the disease and pain process, this is the sympathetic upregulation. Or fight or flight, okay? So when you're ready to survive something or to protect yourself from something, or if you have an injury or if you have an illness, your body goes into this fight or flight mode. And the blood that is supposed to be in the core of your body, doing your vital functions for healing and life, it moves to your extremities, okay? Because it gets you ready to fight or to run, because that's our survival mechanism. That's very important when we need it, but it causes stress and upregulation in that part of the nervous system. So it's what we want to happen is we want to move the body into the other side of the pendulum so that it will heal to a parasympathetic state. Okay, and actually everything that you see at the show, the goal of it is to help your body heal. And it brings you into this parasympathetic state. So you see all of this clean food, good nutrition, energy balancing, muscle balancing, manual techniques. All of these things are to bring that sympathetic nervous system down and to create a place of healing for your body. So in the middle is perfect health, and that is our goal. So scars are one of the things, and we believe it is a key, one of the first things that should be addressed on a person's body, because just because that scar is there on the body, it is locking up the autonomic nervous system in this parasympathetic division, okay? And this is what I'm going to explain as we go on through the lecture. Scars jam the nervous system and they constantly stress it. Okay, so when your autonomic nervous system is upregulated, all of the things that you do, medicines, modalities, these don't work because your body is too upregulated to accept it. You have to push the body into that parasympathetic state. Then all of the things that you're doing to heal yourself are going to be much more effective, and they're going to last and they're going to hold to change the body for health. So let's talk about pain, chronic pain. Okay, look at this list. It's not a very long list, but there's lots of things that a lot of people have. Okay, these are very common aches and pains, chronic issues, abdominal pain, Achilles tendonitis, sprains and strains, back pain, carpal tunnel, chronic fatigue, fibromyalgia, runner's knee, migraine, neck pain, pelvic pain, the list goes on, sciatica, shoulder issues. How many people in this room have one of these issues? Raise your hand. I don't care which one. I just want to see how many people have some chronic pains. And there's probably a lot more that's not even added to this list. This is just a short list. Okay? Now, those are chronic pain problems. Okay? These are diseases related to sympathetic upregulation. You have to remember that the sympathetic upregulation precipitates cellular function on all levels. So if your body is sympathetically upregulated, you are not going to heal. You have to be pushed into that parasympathetic state. Okay, so let's look at these. Heart disease and diabetes, sexual function, libido issues, mood swings, hot flashes, constipation or digestive problems, energy, general fatigue, infertility, neuropathy, swelling, circulation problems, and even cold hands or feet. Now, how many of you in this room can identify with one of these disorders or diseases? Raise your hand. Certainly. So there's lots of issues that we deal with. So what does that mean? If we have chronic aches and pains or some kind of illnesses or dysfunctions, it means we're upregulated. Most everyone is in a sympathetic upregulated state, okay? Now, think about this. I want you to raise your hand if you've ever been to your doctor or your therapist and you're telling them about your aches and pains or your disease or whatever you're working on. Have they ever said to you, I'm going to increase the parasympathetic division in your nervous system so your body can actually heal better? Have they ever talked to you about this balance of the autonomic nervous system? Has anybody heard that? So maybe a couple. Yeah, that's good. But it's not the norm, okay? This parasympathetic state is where we have to go for healing. And scars, this whole seminar is on scars because scars upregulate, miscommunicate to the autonomic nervous system, and they cause pain, and they cause diseases, and they cause the sympathetic upregulation that all of these diseases and pains come from. Okay, so our goal when we treat the scars is to decrease the sympathetic upregulation in the body, and then the body has a chance to heal from some of these chronic aches and pains and diseases. Okay, so here's our 5 things that we're going to talk about. Okay, scars electrically destabilize the autonomic nervous system. They continually stress the system and they miscommunicate because there is an electrical change in the scar tissue that's not normal. Okay? They constantly strain the fascia over the whole body system. We're going to talk about fascia, so if you don't know a few of these things, I'm going to break them down real quickly individual so you can understand them better. They form adhesions underneath the top of the scar. So now the scar is not just on top of the body, but it actually grows and has tentacles and goes internally into muscles and tissues and nerves and bones and whatever it wants to grow towards or attach to. It can cause internal shifts in posture, okay, or misalignment. They sever our electrical and circulatory problems. This is huge. So if you understand acupuncture meridians, that is where our energy flows up and down the body. And if you have a scar that crosses one of those meridians, the energy flow on that meridian or that system is now imbalanced. And you can have disease or dysfunction because of that. And these acupuncture meridians, they correlate with actual emotions and with organs and whole system functions. Then the last thing we're going to talk about is the fact that scars can lock in emotional cellular trauma. And this is really big. When we treat, when you see a person release old emotions that stuck to these scars, it is a really beautiful place for healing. And it really brings a different journey to the patient, a lightness, something that they have held on to, that they feel in their body trapped and they're not quite sure what it is, but the release is beautiful. So to me, this is where true healing really takes place. All of the cellular change, all of these 5 things is what we're talking about. So let's begin with scars in the autonomic nervous system. Again, we looked at scars. Some of you may have some of these, okay? Or you certainly have family or friends that have had very serious surgeries. You have them, you've seen them. Scars are universal, right? Everyone has scars, okay? And not just scars that look like this, but we believe we expand our definition of scars when we do our scar release therapy. We don't just look at a scar that's on the top of the body, but we talk about scars as broken bones, as sprained ankles, as infections, as soft tissue problems. Anytime the body has to heal itself, it lays down extra collagen fibers to make that part of the body stronger. So all of those little areas within the body that have had to heal have this extra tissue laid down, okay, this collagen. When that heals, remember, I told you it was positively polarized instead of negatively polarized like healthy skin. So that becomes the problem. So think about, as far back as you can remember, even if you were 2 or 3, did you break your arm? Did you fall off of a swing set? Did you have stitches under your chin? Did you break an arm? Did you have a motorcycle wreck? Did you have a knee surgery? Did you get hit in the head with a baseball or a bat or a car wreck? You know, you think of all of these things in your life and you begin to add up a lot of little traumas and a lot of injuries. Okay, maybe not a big surgical scar like this, but we're talking about all of these traumas because this is how the body heals itself. So when these little pockets of healing occur in the body, they send out miscommunications to the nervous system. And they just upregulate the nervous system sympathetically. So our goal in a treatment is to go in, have a nice intake from a person's injuries and traumas over time, and treat all of those areas of the body. Because each time we treat one of these areas, we open up the cellular metabolism to return to normal. And each time it begins to bring the sympathetic upregulation down a little bit and a little bit and a little bit. And that is one of the ways that we begin to heal the body by our scar release therapy. So how do scars desensitize or destabilize the nervous system? Normal skin is healthy and it's negatively poled. And when that scar is formed, it forms as a positive pole or a positive pocket of tissue. These scars, they send out unstable cellular signals to the nervous system, and they just sort of mess it up. They just kind of jam it. And if you look at research, these little islands of tissue are called islands of disturbance, or chaotic and noisy signals to the nervous system. So just because the scar is on your body, it's messing up your nervous system, even though the scar is 25 years old. Even though the scar doesn't hurt. The scar does not have to hurt to be causing problems inside the body, whether it's chronic pain or disease or dysfunction. Just because it's there, it's messy, okay? These areas of unstable cellular activity are called interference patterns, okay? And we believe that these fields or patterns radiate in proportion to your previous sympathetic or nutritional status. Okay, so when you're really young and healthy and your muscles are in good shape, you heal faster, right? And as we age a little bit, the strength of our, the health in our body, we don't heal quite as fast. Okay, so it's really proportional to the health of your body. So you think about times when you have a surgery or when you're really sick, we can have a poor nutritional status, even a poor emotional status during a trauma in our life. Okay, so these are proportional. The pain and disease develop within these interference patterns. And the scars and trauma accumulate, and they can feed off of each other, and they can actually connect to one another internally, okay? And all of this, just because these traumas are here, and electrically and chemically, the tissue or the cells are different, they're upregulating the nervous system. So it's very simply, you would say, well, let's just go in and treat them all and deregulate the nervous system. So that is how we start our pain therapy, is by deregulating the upregulation, by treating these pockets of trauma tissue. So scars and the body-wide fascial system. Fascia is the white covering that covers the muscles, okay? It holds the body together internally. Fascia wraps around every muscle fiber, every muscle bundle, and every whole muscle. It wraps around your organs, your nerves, so if your skin wasn't on your body, the fascia would still hold it in place, okay? So it's one piece, from the head to the toe, it's one piece. So if this fascia has kinks or pulls in it, guess what it's gonna mess up? Everything. Who knows what it's going to mess up? It's going to pull and push, and it's going to do things to the body that the body doesn't want, okay? So it's very important that we begin to look at this internal clothing. It acts like a straitjacket. So internally, as that fascia is pulled and tightened, it doesn't allow as much movement as it did before. So this is very important because therapeutically, we're not trained as therapists to treat fascia like that. So I want you, right now, I want you all to hold the bottom of your shirt, okay, one side really tight, just pull it down. And then with that same arm, just slowly move your shoulder up a little bit and feel the tug. Feel how tight that is as your shoulder goes up. Well, as a therapist, I'm taught to treat the problem. I would work on that shoulder, and we would work on that shoulder, but guess what? It's not the shoulder's problem. If you release the bottom of your shirt, your arm goes up very smoothly and easily. Okay, so we find these patterns where scars are and what they connect to and what movements and joints and range of motion they connect with. And it's amazing. As you begin to treat scars, they let this fascia go, and then you have increased range of motion and you have decreased pain instantly. Okay? So the fascia plays a very important role, and actually when we're in school and we're learning muscles and nerves and all of that, in the textbooks, the fascia was cut out. It wasn't even recognized. And now it's being recognized in the last few years as actually maybe potentially the most important system in the entire body, because the fascia is the largest system in the body, And it is the only system that touches everything. So our whole body, our muscles, nerves, everything is connected together through this one system. Now, the very interesting part, and maybe this will help you understand again a little bit better about the fascia and how important it is. Remember that sympathetic upregulation that we want to get rid of, because this is where disease and dysfunction and chronic pain comes from? Fascia, or the connective tissue, is directly controlled by the sympathetic nervous system. So there's a link. So every time you sprain your ankle or hurt your knee or you have an infection or you have a surgery, that fascia heals, bonds, sticks together, changes some things, and it's directly connected to that sympathetic upregulation. And you know, the interesting part is that 100 years ago, surgery wasn't really around. You know, if there was something wrong, they cut it off and went on. But today, we have people who schedule surgeries like a hair appointment. Having some kind of elective surgery or procedure is common. So now you think about that connective tissue and the direct link to the sympathetic upregulation. So I'm a mom, I have 4 kids. So what does this tell me? Well, as a mom, I am really concerned every time my kids have a big bicycle wreck or skateboard, or they're in martial arts, or they do this or they do that, because I'm like, oh no, you know, they're upregulating their nervous system more and more and more. So because I have the tools to do scar release, I go in every time they fall, every time I see something I don't like, and I treat the area, I treat the tissue, I treat their nervous system to try to keep them in a place, a more healthy place, a more parasympathetic state. I don't want to watch their little bodies continue to build up until one day is what happens. Our baseline changes and we get a little bit more unhealthy and our internal environment's a little poorer, and then our hips are out, and then we have another surgery. All of this sympathetic upregulation, at some point, it's gonna tip over into a devastating illness or something that's much harder to come back from. So it is very important, if you're a mom or if you have the control to treat your family, your husband, your parents. This is an amazing way to begin to keep your body in that healing state. So what do the fascial strains do? Well, they cause problem with the nerves. Okay, you see a shoulder's pinched, maybe a surgery here, and then a knee surgery. So now the fascia in between there is being pulled and tugged, and maybe there's a loss of range of motion. The muscles cause tightness. Okay, they can't move properly because they're being restricted like a straitjacket. Okay, like your shoulder was when that tension was really tight on your shirt. This connective tissue, the nerves, the autonomic nervous system flows through this tissue. And if this is tight, putting pressure on your nerves, you're gonna have pain. And also posture. These fascial pulls can misalign your skeleton to where your hips are out, to where to where muscles are tight, and more pressure is being put on joints than necessary. And all of that sets the body up for injury and for more disease. So the fascia attaches to all the body systems, and it affects all the movements and all the organ functioning. So the scars also cause postural issues. So if you have an abdominal scar, whether it's a C-section or a hysterectomy, it could be a hernia or a gallbladder scar, as that tissue heals, it pulls the body in forward, just a little bit. We don't really walk around like this, but certainly after you have this released, internally you go, wow, I felt so pulled down and tightened like I'm against gravity, because that scar is pulling inward into the body. And when that happens, therapeutically, it's gonna misalign your hips. You can have a forward pelvic tilt or a posterior pelvic tilt, or you could have an upslip on one side of your hip. It doesn't really matter. It's what matters is that it can imbalance the muscles, okay? So this fascial pull can change your muscular pattern to produce pain. And if your hips are off, if your sacrum is off, your spine cannot stack properly. So you can have ascending or descending pain patterns if the sacrum is not sitting properly. Okay, so that was the fascia. Okay, so let's take a look real quick at an adhesion. Okay, the adhesion is this internal growth that we don't see. It's below the surface scar. It's like the internal scar that continues to develop. And these adhesions can also cause pain. They can wrap around organs or tubes and cause dysfunction. And they can pull the body out of alignment just like the fascia does. They grow between organs, nerves, muscles, and tissue. They constrict. 90% of people who have bowel obstructions, it is due to an adhesion that has grown internally and wrapped around an organ. Okay, fertility, fallopian tubes, bladder, all of these things, these adhesions can attach to and wrap around and cause to not work properly. Okay, and they restrict the movement and they can cause chronic pain. So they're not good for our health. Again, the adhesions also can wrap around the nerves, causing pain. They can pull the muscles and cause tightness so that the muscles lose the range of motion or the proper skeletal alignment. The organs, such as the bowel and bladder, fertility, all of these issues internally they can attach to. And the fascia. These adhesions also attach and pull the fascia, making those fascial problems more significant. So the more scars you get, guess what? The more adhesions. The more the fascia gets pulled, which is the connective tissue, which is directly linked to the sympathetic nervous system, and the sympathetic nervous system continues to go up and up and up, just because we live every day and we accidentally have traumas. Okay, so now we're going to look quickly at scars and how they affect the energy of the body and the circulation of the body. Okay, scars significantly block the energetic flow on the meridian lines that they are connected to. The scars, they stagnate energy. Okay, so there becomes an imbalance in the flow. And the stagnation of energy in acupuncture is correlated to the upregulation of the nervous system. So again, now we're talking about scars on meridians with circulation, with energetic connections. These energetic disconnections can cause disease. So what happens when we have an abdominal scar? Well, as the horizontal scar gets cut across the front of the midline, all of those meridians that you see also get cut. So this is where the energy stops flowing. So the energy is now disconnected from the feet to the top of the body. And this is vital for health. This is what makes us healthy, a good energy flow. You want your circulation to be moving and healthy. There's 5 key ascending meridians. 3 go straight up the front. Okay, so these scars that block this flow create dysfunction because our circulation stagnates and it doesn't move, okay? Fertility, reproductive health, and all circulation, which is diabetes, neuropathy. These are very common diseases that have grave outcomes sometimes. Therapeutically, what we're learning with our MPS therapy is when you add this scar release to treating these patients with these diseases, they get better, okay? The scars are the key to the circulation and energy flow in the body. The abdominal scarring inhibits movement upwards, and it prevents the energy or circulation going back to the heart. Scars cut our energetic flow and disconnect the electrical systems, and this causes organ issues. Okay, so we have a great example of the circulation and a scar. This was done down in South Florida by a physical therapist who came to one of our pain management courses, and he went back to his nursing home facility, and he had a patient, a sweet little lady who had neuropathy. And he called the office, he got some direction. The office said, make sure the first thing you do is check to see if she has an abdominal scar. Because no matter what kind of work you're doing in her feet to push that energy up, if there's a blockage, it's not going to circulate, okay? So this foot was purple, blackish, and she couldn't wiggle her toes, she couldn't move her ankle, she couldn't do anything. She was actually scheduled to have an amputation. So our physical therapist, he started working on her with MPS. He first did her scar release. Of course, she had an abdominal scar from hip to hip. He released the scar and then further went on to do a neuropathy protocol with her. And 7 treatments later, she had full color back in her feet, good circulation, she could wiggle her toes, move her ankles to music, and on the video, this is on our website, if you go to our YouTube channel or to our website, there's a bunch of videos, and this little lady's on there, and as the video camera moves back, you see that her other leg has already been amputated. Yeah. So it's very powerful, and it's just amazing, okay? So scars can significantly impact the health of your body, okay? They stagnate circulation down around the ankles. They create this environment because they just don't allow the energy to flow. 80% of diabetic neuropathy patients have abdominal scars. So, okay, the last thing we're going to talk about is scars and emotional trauma. Okay, everybody has some level of emotion that's held in your body, some kind of trauma, some kind of emotion from something. These cells actually hold memory, muscle memory. They record things that go on around you, and they get stuck. And as these scars heal, the energy gets stuck and the emotions get stuck because the cells slow down or shut down and they're not properly processing because of this differently healed scar tissue. So a key component to holding emotions in the body is through the scars. Okay? Each scar has a cellular emotion locked into it. Releasing these scars often produces emotional releases, and it really allows your patient to let go of some stuff. Maybe they know they have, maybe they don't, okay? But I will tell you, if your patient is seeking an emotional release or emotional therapy because of a trauma in their life, regardless of what it was, abuse or car accident or whatever's going on in their life that they really know they have some significant emotional trauma for, if they have not received benefit from therapies that they have tried, I can guarantee you it is held electrically in a scar or a tightened muscle. Okay, so electrically, that has to be changed, and those cells have to open up, the cellular metabolism to improve for that energy to be released. So, scars provide the unique opportunity to target emotional trauma. Healing is also associated with reducing stress, because what do emotions do to our nervous system? Upregulate it, very much so. The stress response and sympathetic upregulation are associated with destructive memories, encoded and locked into scars at cellular levels, post-traumatic stress disorder. Mastectomy patients hold so much emotion and trauma in these scars. Traumatic C-sections. Okay, most of us, if we have a C-section, didn't want it, but a lot of them are traumatic, and you'll hear a mom saying, I did not want this, the doctor did this, I feel robbed, things went wrong, this was not what I wanted. These emotions get locked into these traumas, and they really sort of change the personality of the person just a little bit. They're not quite sure why they don't feel right, why things didn't quite go back to normal. They didn't feel like this before. And accidents, of course, there's lots of fear and emotions that get trapped because of any kind of accident. Cellular memory can serve as the nucleus for physiological, psychological, and even psychosomatic illnesses. And to release the scars, we release the scar itself, but we also have the ability to hook them up to acupuncture points that release and target specific emotions. And that is something that takes our treatments to a much deeper level for healing with our patients. Okay, so now you're saying, okay, so you said all this good stuff, so what do, right? How do we release scars? Well, we use a handheld microcurrent device, and it is a DC, so it is a direct current, which resonates with our body's natural energy flow. The body has to have a DC spark to heal. So DC is very, very important that you're using direct current to heal the body. But the microcurrent, it is what is so powerful about microcurrent is that it is the healing range of electricity. Within this range, true endorphins are released, so we know it treats the nervous system. You have to treat the individual nervous system first. You want to deregulate the whole sympathetic system. Then the other things that you use in your practice or in your personal healing toolbox will work better. So our machine, the DC microcurrent, mimics the human nervous system, and this promotes healing. There are 3 things that are critical to healing that microcurrent does. It produces 300 to 500% more ATP production when you use microcurrent. That is like healing on speed. You are powering these cells to work properly, okay? It increases the protein synthesis at the cellular bases, and the cellular membrane transport begins working again. So the sodium, potassium pumps begin to work again, and the proper chemical exchange begins to work. Whereas before, it did not. That tissue healed differently, and it was a positively pulled tissue. So we go in with this microcurrent system, and just by treating the tissue alone, it sends the microcurrent back and forth through these cells, and it kind of like plugs them back into the energy socket. It helps them work cellularly, okay? This reconnects the body's electrical system. So this is our unit. It's a little small handheld unit. It is concentrated in point stimulation, so it has a very direct focus. The tip is like a needle, okay, but it's not quite that sharp, but it's small so that you can get a lot of energy focused into one point for a very strong outcome. It is parasympathetic stimulation. So this tool automatically deregulates your sympathetic system just because of the electrical parameters that's in it. TENS, ultrasound, injections, all of these are sympathetically upregulating devices. Manual therapy cannot electrically repolarize the scars and change the cellular basis. But microcurrent is ideal for the scar and adhesion release. So how to apply? This is a picture of a scar before and after. And in our therapy, we are pain management, and we really care and focus on the chronic pain in the patient's body. But the really amazing and exciting thing is that when we actually treat a scar, we get cosmetic changes as well. And it changes right in front of your face. It changes the first time or two you start to treat it. It's not 2 hours later, it's not 5 days later, it's not 10 sessions later. It's the very first time the tissue changes color. If it's a dark red, purpley scar, it's going to become more skin-like. If it's hard, it's going to become much softer and more pliable. So, and like a hypertrophic scar, they raise up above the skin and you can feel them. They're lumpy and bumpy. That skin will flatten out, and when you reach down or you go to feel of it, it just flattens out, and the patients are like, well, I can't even feel of it anymore. Like, where is it? So cosmetically, you can work a scar as long as you want to continue to change the tissue and relax the pulls underneath. But of course, we really care about the pain and the dysfunction that these adhesions are causing in the body. Yes?
How soon after surgery can you use it?
You can use this instantly because we're not pushing the tissue, we're not pulling on it, it's not a manual therapy that you're trying to unwind. And the amazing part is that the microcurrent is good for healing. So if you have these units and you have a surgical procedure or a surgery or somebody that you know, you want to treat this as quickly as possible because it's empowering the cells so much. Your healing's going to be faster, you're going to have much less swelling, much less bruising, and much less pain. So it's very good for healing, and it would be instantly.
About how long do you use the machine at the start?
For how many treatments?
Oh, no, like
Or
how long on each session? 5 minutes?
it's 5-10 minutes. Yes.
Is this available in Toronto?
Yes, we have them. We have some here, and we're going to demonstrate in just a second if I can quit talking.
Continue to take, if you have time, take the question.
Okay, yes. So we'll take questions. Let me keep going real quick, just so you can see. I'm just going to walk you through the steps, and then we're going to demonstrate, okay, if we have time. Okay. So this is what happens, okay? Electrically, remember I told you that that scar heals, and it's positively poled. The surrounding tissue is healthy, and it's negatively poled. Okay, so what we do is we take 2 units, the 2 dolphin neurostim units. It's a dual application. You have to use 2 units for the scar release. And you set the polarities on the unit, 1 to negative and 1 to biphasic. And you basically walk down the outsides of that linear scar like where the stitches would be, like electrical sewing. And you hold each point 15 or 20 seconds, and then you just move 15 or 20 seconds, and you just walk down the outside of the whole scar. If it's circular, you just go in a circle. Okay, so that's the first step. Then it's what you see. This is our goal. Okay, this is the application process. You have negative healthy skin. Then you have a scar that pops up, and the little plus on the top is that scar tissue. So then you're going to take your dolphin neurostim units, negative on one side, biphasic or positive negative on the other side, and you're going to treat around the scar like I just showed you, and it's what it's going to do is it's going to repolarize the skin tissue back to a normal, healthy tissue where the cells are actually working properly. Okay, so the method, you're going to locate the scar, treat the scar bilaterally, and plug the ends. And that just means that you plug both ends, and this time the electricity goes up and down the scar because you've already had the electricity go back and forth across it. So we're just getting it from a different angle. Now, we add a few other points, acupuncture points, to further this release. This first one, B62, is an acupuncture point that we use as a soft tissue point or as a fascial relaxation point. So we actually hook B62 up to the scar itself, and it's what that does. It provides a deeper, softer relaxation of the tissue underneath. So it's a stronger release in the soft tissue. The next point that we do is stomach 36. We do this circuit because the stomach meridian runs right up through the abdominal area. Okay, so it further releases that whole internal abdominal area for scars. Then the last point or it's not the last point, the next point we do is spleen 6. This is a Hulk energy point in the body. This is like a pool of water or energy, and when you hit this point electrically, it sends the water or the energy, the electricity, up the front of your body, up those 3 meridians that we want to make sure are released so that the energy can flow. So we always put these in our scar treatments to move that energy up from the feet. Now, we have a couple of additional points that we're using. This is where we side lie our patient. This patient will have an abdominal scar, the dots on the front, and we're going to use governing vessel 4, the acupuncture point, because this is opposite to the umbilicus. Okay, so this is our essence of life. So it's what we want to do by treating this acupuncture point. We're breathing new life into this internal area. So we're holding 1 unit on the back on governing vessel 4 while we're walking around the scar in the front, but it's driving the electricity from the back to the front instead of just on the top of the scar. So it helps to clean out this whole abdominal area because we don't know where those little spider-like adhesions go to and what the fascia is doing. So we have 3 points that we do in the back. We do governing vessel 4, and then we do B25 on each side because this is for elimination, okay? The last point that we hit is gallbladder 12, and this is to stimulate the vagal nerve. Okay, now this is interesting because again, I'm a therapist, and I was taught that every modality that we ever used in the clinic, you were not to stimulate the vagus nerve. Well, sympathetically, you don't want to stimulate the vagal nerve because you'll stimulate lots of things and mess up lots of organ functioning, and just your whole autonomic nervous system will go up. But now I'm using a parasympathetic device. I want to deregulate the nervous system, so I'm using the device on the vagal nerve to decrease the upregulation. So it's beautiful.
Do that on both sides?
Yes, both sides. And we connect it to the scar. So we hit the acupuncture point here, and then you can connect it to the scar wherever the scar is. So how much pain relief do we expect to get with MPS? Okay, I'm just going to go over this one slide, and then we'll do one or two quick. We have 5 minutes. Okay, so I'm going to say 2 seconds here. The first 32 patients, because this is important, okay? The first 32 patients that we actually looked at and just isolated the abdominal scar, we were getting such crazy changes in people. We said, wait a minute, let's just see if we only do the scar, what happens? No other therapy. We took 32 women with a C-section, and the only criteria they had was a C-section and pain somewhere in the body. That's all we measured. We didn't care how long it had been there. We didn't care how old it was. We just said, do you have pain? Yes. Do you have a C-section? Yes. Okay, let me treat you. And we said, what's your pain level? It's a 6 or a 7 in the neck, the back, whatever. We didn't care. Treated the scar, very simple, most basic scar release. Then they get up and we say, what's your pain now? Over 32 women, we had an 80% decrease in pain in one session that took less than 10 minutes. That kind of blew us away. That really started showing us that scars centralize pain and lock up shoulders and knees and hips and joints and all of that stuff, okay? So, we have 5 minutes left. To do a really quick, I want you to palpate. I need somebody who's a brave soul, who has some kind of tummy scar that hurts or that's hard, that has pain. Do you have pain? Does your back, hips, what do you have?
At the back, yes, the lower back.
Okay.
Pain. I have an ugly scar at the front, and I always feel something inside my intestine, somewhere near the descending colon. I don't know.
Okay, so come on up real quick. And guys, I'd like for some of you to come as close as you can so you can see this. A few of you can touch it and palpate it. But guys, we are in booth 627, so in just a minute we're going to get kicked out. We're in booth 627. We are treating scars for free all weekend. So please come, bring your scars, bring your friends, come have fun with us.
I don't like scars.
Yeah, okay, so lay down right here real quick.
My head over there?
Yeah. And so
I had
what?
a C-section with my second child.
Okay.
It was full of pus for a long time, and it was very ugly.
So somebody, if a couple of people touch, okay, it's a little raised, a little ropey. So I know we're just throwing you down and.
I'm okay.
So it's
I
vertical
This,
rather
yes,
than horizontal?
yes, hers is vertical. Okay, so
So are you talking about trauma? I felt
So-
like I was mourning my body after because I felt so bad
that
that they
tight.
did that without telling me this way as opposed to this way.
okay, so are you listening? She's
So I
already
feel like
telling
I
you
had
she
tears when we
mourned
talked
from this
about
scar.
this.
They did not tell her they were doing this. This is not the birth she wanted. Okay, this emotion is in the scar. The energy's stuck. So simply, okay, and the scar release, it doesn't hurt. Okay, unless there's a little nerve that's wrapped in the fascia somewhere, it might hurt a little bit, but it doesn't hurt.
No.
One of the units is on the scar and one is beside the scar.
Yes. Oh no, sorry. Both are a little bit. You can't hardly see it right here, but I'm just a little bit outside, on the edges of both. Okay.
So
And then I'm just going to walk down the outside of it to begin with,
one of them is negative.
and one is biphasic. Yes.
Can this be effective some years after the scar is
Yes,
done?
and actually the older the scars, guess what? The older ones appear to cause more trauma later on. Yeah, so I treat women all the time that say, but my C-section doesn't hurt, it's my back or it's my neck. You know, and I'm like, it's
I
okay.
do have problem with my
So you have
neck
some neck
here
pain?
on the left side, and
Yeah.
I get headaches all the time, and I don't know where my headaches are coming from.
Okay.
Actually.
This could be it. The fascial train, because the fascia is one piece, it pulls all the way around the body. Like you can actually, like Tom Myers, some of these people like actually will dissect the fascial trains out and how they wrap around the body and connect. But the head is connected to the toe when we talk about this fascia. So even a scar on the toe can be causing headaches. It's crazy. It's definitely a little bit of out of the box. It's not what we're taught in school. But when you see it happen and you see these changes, you can't argue. You just go, wow, I want to do that to all my patients.
Would you be able to if someone was pregnant?
Yes.
Use these devices?
Yes.
Actually, to your point, my mother had a hysterectomy years ago,
Uh-huh.
and recently the doctor told her she had an adhesion that was twisting the bowel, and
Right.
she had bowel obstruction.
Yes.
My mom had that too. She had a scar like this and had her ovaries removed, and she had a bowel obstruction as well, and
Right.
colon cancer
Kelly.
as well.
Yes.
She had this facial scar at 7. Now she's 29 years old. But the reason Dr. Gokal is here is because that scar was so pronounced, it was about that long and about that deep, and after 3 applications, look at it, it's almost gone. That's it. This is it.
5 minutes.
Would you repeat, you said one is,
Yes, one is negative
And the other
and one
is?
is biphasic.
what is it called?
Biphasic, so it's a plus and a negative. So it has both. So you can just say plus or negative or biphasic or bipolar. But do you guys who are up here, do you already see the change in the skin? And I've already, when we treat a scar, we treat it 3 times. Like in one application, I would sweep it 3 times. But look at the tissue change. Look how soft the skin is. A huge difference.
Amazing.
Like the top of it, you can't feel at all, really, until you get down here and it's a little bit ropier.
Now, will this last?
Yes,
Yeah.
yes. So this
Once
lasts.
you do it, it just
You're good.
opens it up.
That's right.
It releases.
It releases.
And then now on this side, I always feel some kind of discomfort. So I'm like,
And it's
thinking
probably, it's an
adhesion or
adhesion.
something
It's a
like
pull. Absolutely. Yes.
Just give me a second.
2 minutes?
Yeah, not even.
Okay, so not even. We don't even have 2 minutes. So come to our booth. We'll be treating. We'll teach you more. You can learn a little bit more. See the units. Oh, we have educational courses. Okay, so we are a pain management company that we teach doctors, acupuncturists, therapists, but we have tons of lay people who come to learn to treat themselves as well or their family. So anybody can come to the courses, and we have them in Toronto on Lakeshore. We usually have up here in Canada, but we have them all over the States. So if you want to come to Florida, New York,
Do you have them in the New York area? Tri-state area?
we don't usually have them in New York, but we do have a couple like Chicago.